Good morning. This is Dr. John Bennett in the conference ACNS, the Asian Congress of Neurological Surgeons, and today we have the pleasure again of having Iype Cherian, MD, a noted neurosurgeon from Nepal, proponent of the cistern ostomy. He's going to do another talk on the cooling and cleaning function of CSF. But first we'll introduce the panel before Iype starts. Okay, Gaurab, could you please introduce yourself?
Yes, I'm Gaurav Bhatta from Nepal. I'm studying MBBS in College of Medical Sciences, and that's about me.
Welcome, Gaurab.
Yes,
And
I'm honored to be here.
Thank you. Thank you. Javan, can you unmute yourself, please?
Sir, I am Csf from Nepal. Currently, I had given my final MBS exam from Kathmandu Medical College.
Okay, and Roberto, you want to say hi before you head off to bed?
Okay, I'm Roberto from Buenos Aires, Argentina. And
yeah.
a good friend of John and Iype.
Yeah, I have to admit, I roused Roberto out of bed to come to this, and I'm glad he's part of it. And good day, Iype.
Yes.
John, thank you. I'm just going to draw a few figures. So I'm going to screen share right now, straight off. So let's put this radical concept. After cystostomy, this is my most radical concept.
Okay.
So we just published this, so I'm going to go on with this. All right. So let's start off. You can see my drawing?
Yes, we can.
So let's use a very simple diagram. There, that's a brain. That's a system. So we know that there are vessels. So let's draw the vessels. These are the vessels, but the vessels are going to branch all over the brain. You see, these vessels are going to branch all over the brain, even into minute millimeter, micrometer spaces. These vessels are going to branch. If you see the vessel branching in a brain, it's amazing. It's almost like the universe. Okay, they're going to branch like that. But one thing that we have not paid attention in all these years is that the CSF, the Varsha-Robin spaces accompanying these vessels, are also going to branch all over the brain. That's exciting. I mean, when we came to think about this, this is completely exciting for me. Now, what is the implication of this CSF traveling all over the brain? Two things. Now, I'm going to make a few statements now. Number one, the brain is one of the most metabolically active organs. So, metabolically active, very active. So, whenever something is metabolically active, there are two things which are produced. One is heat, another is metabolic byproducts. These are the two things that are produced. Now, the brain produces 0.6 joules per gram of tissue per minute. That's very high. How are you going to cool the brain? So, we should think that the blood that flows, artery that flows, is going to bring in cool blood. And the venous blood is warmer than the arterial blood. So we thought we had our answers. Then we understood that it may not be the case. So we have CSF here, which goes through all these small minute channels, and whenever there is an activity, you know that the blood flow to that region increases. It increases much more than that is actually needed. If there is an activity in the brain, and let us say the brain needs 20 microgram of glucose, and the blood flow needed for that is, let's say, 2 units, the blood flow is actually 4 units. Why is that? We figured that was for the cooling. We thought it was for the cooling, and then we started looking for evidence, and then we had a lot of evidence saying that the brain is actually cooled by the CSF. So now, how is the CSF cooled? That was something which we didn't have an answer for. Now, again, we came to this very crazy concept. It's completely crazy. You see, next 1 centimeter away from the suprasellar cistern is the sphenoid sinus. What is the purpose of sphenoid sinus? Or what is the purpose of ethmoid sinus?
It traps the air.
It is to humidify the air. It is to humidify the air. Now, the humidifying the air, now, you know, the designer who designed us, whether it is God or whoever, people believe in God, people believe in something else, but whoever designed it, designed our body, has put much more than 1 functions to us. So we thought we have found the answer. It is humidifying the air, humidifying. But whenever something is humidified, you must understand that there is something called latent heat of evaporation. It is so simple. You sweat and you sit under the fan. You are humidifying the air around you, because with your sweat you are humidifying the air around you. But what's happening to you? You're becoming cooler, because as the water evaporates, it is the same principle of air conditioning, everything. So as the water or anything evaporates, there's a latent heat of evaporation. And sphenoid sinus is cooler than the rest of the head. And the sphenoid sinus is very close to the suprasellar cistern. And by bone is a fantastic conductor of heat. Bone conducts the heat, the suprasellar cistern. And the suprasellar cistern is getting cooled at least by 2 degrees centigrade. And you know, this advantage is gone when you ventilate a patient. When you ventilate a patient, this advantage is gone. And it is already proven that when you ventilate, the pressure in your, the heat in your head goes up. It is called something like a shunting syndrome or something like that. When you ventilate the patient, the heat inside the head goes up. So the sphenoid sinus is cooling. It's humidifying air. It's also cooling. It is cooling, and the sinus is very close to the suprasellar cistern. Suprasellar cistern gets cooled, and the CSF enters from the suprasellar cistern into the brain. That also is cooled. You see what a crazy concept, what a radical and a crazy concept this is. It may be proven right, may be proven wrong, but you see, it is important in cooling. Now, the next thing is cleaning. 7 years back itself, I proposed that the CSF goes in, and the only way it could go in was Varsha-Robin spaces. But till the paper of G-lymphatic pathway came in, G-lymphatic pathway was a radical change. G-lymphatic pathway came in, and they proved that actually through the Varsha-Robin spaces, CSF goes in. And then now they are figuring out the importance of the G-lymphatic pathway. Then people thought it was a rudimentary pathway. No, it is not. Imagine if this G-lymphatic pathway gets closed. What happens? The waste of the brain and the heat of the brain is not cleared. This is what leads to, I believe, this is what leads to degenerative processes. Degenerative processes like Alzheimer's, Parkinsonism, and all the other things may be due to the closure of these fantastic canals present all throughout the brain. So when these are getting closed, then you have neurofibrillary tangles. Again, one of the things that you must notice that in Alzheimer's, the heat shock proteins are expressed so much. Why is heat shock proteins expressed so much in Alzheimer's? You have chronic traumatic encephalopathy. Somebody there was a movie very recently, Concussion, very famous movie. What happens in chronic traumatic encephalopathy? I believe it is subarachnoid blood blocking off these channels so that you start a process of degeneration. These fantastic channels are closed off and you start a process of degeneration whereby your heat and your waste is not clear, and then you have a process of degeneration. You see how many things this theory is answering. And now for the most interesting thing that happened in the last 1 year. You know, in mice with Alzheimer's, there was a company, there was a group in United States, they introduced the bacteriophage. They introduced the bacteriophage into the olfactory mucosa. And after that, the Alzheimer's symptoms, it started reversing. So what does the bacteriophage do? Probably the bacteriophage eats away this blockade. It probably eats away this blockade and probably renders these canals
I think we have a frozen screen, I think. Yeah, okay. Can you hear me, Iype? Can you hear me? Can the rest of everybody hear me? You can hear me, Simon, right?
Yes, sir, we're hearing you.
Yeah, okay. Okay, Gaurav, you can hear me, right?
Yes.
Okay, let me text Iype and tell him that.
You can go out and come back in.
Okay. Okay.
Okay, he dropped off. He'll come back in.
Okay. Very good. Well, I guess we'll take this time now. And now seeing Roberto's on the panel. Roberto, so you said you do cysternoscopy along with decompressive craniectomy. Do you do it very often or just once in a while? Can you hear me, Roberto, okay?
No.
Roberto, do you do cysternostomy very often? Have you done it very often?
I am dedicated mainly to tumor and vascular surgery, not many trauma.
Oh, okay.
But we are starting in the hospital to do the cysternostomy. I believe in this technique. I agree with Dr. Iype Cherian.
Okay, so some of your associates know how to do it and they do it? Okay,
Yes.
well, okay, I'm sorry, Iype is back, I guess. Iype, are you there? Can you hear me, Iype?
Yes.
Okay, go on, continue, please.
Now, did you hear about our theory on till what part did you hear about the cleaning and cooling?
Yes.
Simon, we did. Yes, we did.
Yeah.
Did you hear about the fact that about the bacteriophage part?
Yeah, that
Yes, we did.
It's away the blockade. You told that.
Yeah, it's very interesting.
So, Roberto, did you hear that too? About the bacteriophage?
Yes, very nice, very nice.
Yes. So this is my current field of research right now. This is what we're going to look at, and it has got a huge implication in a lot of degenerative disease, not only in trauma, but it's got a huge implications in places like Alzheimer's, chronic traumatic encephalopathy, and a lot of other degenerative diseases, where if you can introduce something which clears away these Virchow-Robin spaces, you are going to reverse or at least stop the degenerative process. So this is my current topic of research, and it's a very hot and very controversial topic, just like cysternostomy. So this is what I wanted to share it with you. But it is related. This came about because we started exploring the Virchow-Robin spaces, and we started exploring what are the functions of CSF. You know, for the medical students, I wanted to tell you one thing. If the CSF, you know, the CSF was believed to be just for buoyancy. You know, the brain is a very, very soft organ. If you put the brain into the top of a table, the brain is just going to flatten out. The fresh brain is just going to flatten out. Not completely, but flatten out at least 20%. So if you put it in a bowl of water, then the brain will retain its shape. So we thought that the CSF was for buoyancy. But do you know why it is not correct? It is not just for buoyancy. It may be also for buoyancy, but it's not just for buoyancy. You know why? Because the CSF is changed 4 to 5 times every day. 4 to 5 times. We secrete about 500 ml of CSF every day. And the volume at one time is only 150. So about 4 to 5 times the CSF is changed. Why? Why do you change your shirt?
So to clear away the metabolic wastes.
Yes. You know, it is because it gets dirty. The CSF is getting dirty, and that is why it is designed to change 4 or 5 times a day. So this was what we started off with. And then we came into a lot of, you must read this paper. I will not be able to elaborate all the evidence, but this paper has, the cleaning and cooling paper has a lot of, I mean, we're putting in all the evidence to show you that actually CSF has these 2 functions, cleaning and cooling. And what happens? What is a potential scenario when you have this block, this fantastic canals which are there in all micrometers of the brain? When this channels are lost or these channels are blocked, what happens to the brain? I mean, so this is what I want you guys to focus on.
Yes, sir.
Questions?
It sounds very, very interesting, sir.
John, Roberto, questions?
Yeah, I'm
Oh,
sorry, on mute there.
brilliant.
Go ahead, Roberto.
It is brilliant conference. Iype, in bilateral trauma, you do you the bilateral cisternostomy or only one side?
Unilateral. Supposing if it is bilateral trauma, and on one side I have a large contusion or a subdural, and then I go take the subdural, I would do the cisternostomy from the same side. But on the other side, if there is not much of a subdural or a contusion, I wouldn't really go to that side. I'm not worried about moderate contusion, not a big contusion. If it's a big contusion, I would do cisternostomy, get the brain to be lax, just take out the contusion from that side. I've started doing that right now. But usually, if it is bilateral trauma and if there is a large subdural on one side, I would do only a cisternostomy from that side. I would not go both sides and do cisternostomy. Yes, John, Simon.
I'm sorry, any more questions from the panel? I'm sorry, I was coughing there.
It's great to have Roberto here. It makes it a fantastic discussion because Roberto is a fantastic surgeon, so he understands what I say. The medical students, I don't know, maybe they're getting about 60–70%. I am trying my level best to keep it in their radar. I'm trying not to go above their radar. So
it makes clear sense to me the way you're presenting it. Very simply, thank you very much, and it sounds logical to me. And I'm thinking about a car engine and the way it's cooled, for example. And one question about the choroid plexus: is there any way that we can control the how CSF is produced, or how much is produced, or the temperature?
You mean, in earlier times, Walter Dandy had done this surgery called, he used to destroy the choroid plexus there are certain surgeries which they used to put in an electrode and electrocoagulate the choroid plexus. I mean, that was done as a treatment for hydrocephalus. That's not done anymore, but I don't know how to control. I wouldn't really know how to control the CSF production. I know that it is increased in infections. In certain conditions, it's increased, but in a tumor called choroid plexus papilloma, the CSF production can be increased. But I really wouldn't know how to control the CSF production. Although it's a good question, I might look on it.
Thank you.
Anything from Roberto? Roberto may have something to say on this one.
Iype, do you think the ventricular drainage can help in touching?
Yeah, I mean, I get your point. Now, this is one of the most frequent questions that I encounter. So let me just go to my my Sketchbook Pro and let me show you this. This is a most frequent question. A lot of people ask me this question wherever I go, all over the world. This question is asked. So let us go to. So let us go to the ventricular system first. That's a ventricle. That's a lateral ventricle. That's a third ventricle. That's a fourth ventricle. So let's fill it up with CSF.
Well, it looks like you used this tool before.
Now we're going to show the cisterns. So now we'll show the cisterns. And the thing is, the interesting thing here, and now let's show the brain. Now that's a very rough sketch. Now what I want to show is that the most important thing, the key to Roberto's question, there is no interaction between the ventricular CSF and the brain, while there is big interaction between the cisternal CSF and the brain. Or in other words, this is a production phase. The only thing that you can achieve by putting a ventricular catheter is to decrease the CSF production which is going into the cisterns. Yes, it decreases the pressure, because if you take out 2 ml of CSF, that decreases the pressure, but it will not really reduce the pressure in a traumatic brain, especially when the traumatic, especially since the trauma ventricles are very, very small. So this is in the G lymphatic system paper, G lymphatic system. If you search out G lymphatic system, it is very clearly shown that they injected markers. They injected markers into the ventricle like this, and they injected markers into the cistern like that. In half an hour, these ventricular markers were not seen on the brain, but the cisternal markers were everywhere. Everywhere. So this means that the cisternal CSF is communicating with the brain. And when you decompress the cisterns, you literally, because it is like 2 balloons in communication. So when you're decompressing this balloon, you're automatically decompressing this balloon also. So it is like one of those Tom and Jerry cartoons. When you just put in a needle here on this balloon, this also comes down. So I hope that is the answer to your question, Roberto.
Yes. Yes.
Well, that's exactly, you just answered my question, because I was wondering why you didn't do ventriculostomy.
Yeah, that's the answer. That's exactly what Roberto asked.
Right, yeah. I can see why.